So we won't have time to go around for everyone to introduce themselves, but if you could drop your name in the chat, the organization you're representing, and who you're thinking about bringing together for the maternal health conversations. If you don't know that, that's totally fine. But just to start sharing a little bit more about ourselves. Um, and then, hi, Emily. So I am going to share my screen. This will be a lot of me talking. So apologies, it's usually not this way, but we have a lot of information we want to cover. But we do have some partners who were part of this project last year. So I may call in a few of you all to share your experiences. And Rosie, before I forget, I'm going to make you and Haya both co-hosts. So if more people join, you can let people in.
Recording, okay.
Okay. And also, thank you all just for being interested in this project and for being excited to learn more. So, just as an overview of what we'll be covering the next hour, I think the invite's an hour and a half, but we are only going to be together an hour. I'm going to share really briefly a little bit about Vital Connections, and then I'll spend the majority of it just talking about the project, what it's looked like the past 2 years, and how it's going to change a little bit this coming year. And then I'll spend some time going over the request for proposals, request for partnership, and then leave some time for Q&A. Please, if you have questions as I go, put them in the chat. And as I said, we'll have some time to ask questions to past participants too, just to like help bring it to life a little bit more. And because I'll be presenting, Rosie and Haya, if there are any questions in the chat that need my immediate attention, just like call them out so I can pause. So, for those of you who don't know about Vital Connections, we are a young organization. We actually just celebrated our 5-year anniversary in November, which was really exciting. And we are dedicated to community-led systems change. And we really exist to address what we call the Boston paradox. And so, as you all know and experience, it's really rich in many things, rich in activism, community-based organizations, healthcare, a lot of universities, but we still see these really persistent health inequities that span across neighborhoods that are rooted in and driven by historical disinvestment, structural racism, and there's still a lot of siloing happening and resources not going to the places where they need to go. So, Vital Connections, we don't do any direct service providing or programs, but we try to use our capacity and all of our partnerships. We have many, many partnerships across the city, but we do that to address what we call like different pain points. So, trying to reduce the siloing of services, trying to reduce the duplication of efforts, and this fragmentation of care that we see. And so, as I said, we are really focused on partnerships. So that's with community members, community organizations, healthcare systems, community groups, and we work together to start shifting and redesigning the systemic conditions that we're living in to create more of a thriving ecosystem. And for us, it's really important that it's focused on collaboration and community leadership. I'm talking about our maternal health initiative, but we also have initiatives in mental health, food access, long COVID, and then community-based wellness. So for this project, just to ground everyone in our project goals, our first goal is around access. We want to take maternal health out of the healthcare setting and make it more into an everyday conversation, make it a kitchen table topic. And what we mean by that is we want to have everyone have a better understanding of the current state of maternal health, what are options for giving birth, what are resources that can be used to support birthing folks and their families, and also create spaces for people to share and heal. And I'll talk more about this, but we try to do this not just through talking, but through really creative means. We're also focused on education. So we want to work with trusted organizations such as yourselves to create spaces for people to educate themselves, each other, about diverse birth options, such as midwifery care, doula support, the birth center, which will be opening up spring 2027, which is amazing. And we also want people to learn about perinatal mental health. And we're not doing this just through you all. We're partnering with kind of a fleet of midwives and perinatal mental health specialists to help deliver the information. And then we want to explore and uplift community perspectives on maternal health, learn about people's birth stories and visions for a liberated birth, and and then also share those out. So it's not just staying within here, but being shared out to other systems so that we can start to make the changes that we really need to see. And then lastly, on the action piece, we are identifying and bringing together a advisory committee that's representing, different parts of this ecosystem to take collective action based off of what we're hearing from the community from these conversations that you all are hosting. Before jumping into the rest, I want to just like start with this quote that I think is really powerful. And it says, "I was surprised to learn my own story was worth telling. I always felt, since I did not know facts about my own birth story, that it's pointless to discuss. But it's not, and I have just as much reason to share and heal as the next person." And I think this really highlights the power of these spaces and the different groups of people we're bringing together. And this photo was actually from the Family Nurturing Center, partnered with the Bowdoin Street Health Center. They brought together a men's group and yeah, had some really illuminating conversations. I'm just going to quickly go into the chat. I saw we had a few more people join, so welcome. Thank you so much for being here. Little project overview. So this project came out of a partnership with the New Commonwealth Fund and Mass General Brigham. And this project came to be because of this concentrated focus on maternal health after the report on the Special Commission came out in 2022 that called attention to actually worsening racial disparities in maternal and infant health in Massachusetts. And again, it's one of those things that like we have incredible healthcare, incredible resources. This should not still be happening. And actually, that led to finally this maternal health bill being passed August of 2024. And this is really overhauling the maternal health system within Massachusetts. So it's expanding coverage for midwifery, birth centers, doulas and screenings for postpartum depression. So yeah, really exciting progress, momentum, and NCF identified vital connections to help spread information so that people within communities could know more about what resources are available to them because doulas, midwives, and birth centers will become more accessible. So year one kind of started off as a pilot year, worked with 6 organizations. Ariel, our executive director, was actually co-designing and co-facilitating these conversations. Year two, we wanted to work with more people, and we realized we couldn't facilitate every single conversation alongside our partners. So we created a maternal health toolkit that was really comprehensive that I'll share more information about to help make it a little bit easier for our partners to independently, but still with support from Vital Connections, facilitate these conversations. And we worked with 11 community organizations and community groups. And this year, we're increasing partnerships even more and expanding the toolkit to have a module on perinatal mental health and self-advocacy. And we're updating our family and pregnancy resource guide. So a little bit about phase one and phase two. So that was the past 2 years. These are our partners from the past couple of years. And as you can see, they range from health centers, schools, run groups, gyms. And I'm highlighting this because you don't have to be in the maternal health space to host these conversations. We actually really want to make sure that we're working with a range of people, a range of organizations and populations, because we want not just birthing folks to be a part of this resource sharing and knowledge. We want everyone to see themselves a part of this. We also, I said, worked with a cohort of midwives who joined each of these conversations to talk a little bit more about, what's midwifery care, what's the difference between a midwife and a doula. And so we'll have that piece again. Just continuing to highlight people's experiences. A project partner said, "The project not only centered the lived experiences of birthing people in our communities, but also highlighted the importance of holding space with care, compassion, and attention. I'm deeply grateful for the opportunity to contribute this work and to be in community with others who are committed to justice, healing, and systemic change." And yeah, just to say that we have been so grateful to work with other people who are in this space who really care about making a difference. And this photo, I also want to share, and you all can, keep these in mind, is we aren't just having people sit in a circle and talk. We really want to invite you all to envision like what space will allow people to share, to dream differently. And so this was in a space and they incorporated movement and yoga. You can see there are blankets. People were laying down, people were drawing with big flip chart paper. So thinking expansively about what these conversations can look like. And so, conversation formats, you're probably like, what does this even look like? Um, and I'll go into that a little bit more, but people have the flexibility to design these conversations based off of what works for you and what works for the participants you're bringing together. Um, so, we have again, worked with a range of different populations. La Alianza designed theirs in a 4 week series. So it was over 4 weeks in the morning time, and each session was 2 hours. And there was co-facilitated by three staff. Epiphany School brought together some of their students, women of color, and they had it over Saturday. So two 3 hour Saturday sessions. Young Man with a Plan, they have programming that's in the weekdays after school. So they did over three 2 hour weekday sessions. Um, they will be a little bit longer this year because of adding a few more modules. But the first year was even more condensed, I will say. Um, Union Capital did three 2 hour sessions after on weekdays in the evenings after people finished work. Um, Freedom House did it over 6 weeks, so shorter sessions, but more sessions. And then Bowdoin Street Health Center and Family Nurturing Center did two half-day Saturday sessions. And so these are just a few examples of how people structured their time. Um, we'll share more about the kind of conversation arc that people follow. But as you can see, people included journaling, collaging, lyric writing, role play, poetry, and then really visioning on liberated birth and identifying community assets and needs. And then for this past year, we had a partner. Each partner was joined by a midwife who helped co-facilitate one session to talk about diverse birth options. And this is are a few more photos that bring together like what people were doing. So people had flip chart on the wall, walking around, and were drawing their reflections on what pregnant people need to experience in order to have a healthy birth. People are cutting up paper to for their collages. So yeah, just seeing that we encourage people to be interactive, up and moving, and make it your own. This is a reflection from a birth story. All I felt was fear of pain and not being able to do what I felt I was supposed to do. And I think this is such a powerful and difficult thing to hold. And again, the power of these spaces is some people are sharing their birth story for the first time and in a trusted space where they're able to, again, share and heal alongside other people who may have had similar experiences. I'm going to pause and just see if there's any questions about kind of formatting or if people from last year want to share a little bit about um, their decision to do it over these times. And no worries if no one else, if you don't want to share anything either.
I can quickly hop in. Hi everyone. Can everyone hear me okay? Okay. Hi everyone. My name is Abeo. I'm happy to be here in community with you all. I did this project in the second phase with my run group Trailblazers Run Co. And we hosted three 2 hour sessions and hosted those over the weekend. And that seemed to be, pretty accessible with people's scheduling. And so I encourage you to just, survey if you're able to survey the needs of your group, the availability of your group, and maybe kind of backwards engineer that way to get a sense of like what times are people going to be able to commit to, and then within their availability, find your availability to facilitate it. That was something that was helpful for us. So, yeah, that was something that worked for us, and happy to chat with anyone who is a newer partner. Happy to connect with you on brainstorming.
Thanks, Bea.
I actually had the ability, hi, I'm Lanisha, sorry, to be a participant two times. One was with Abeo and the next one was with Stephanie. And it was during my time of postpartum, especially like the early t time or early stages of postpartum. And when I tell you that it really helped me get to a space of light because I felt like I was going through a lot at that time. A lot of things were shifting. Just trying to understand myself as an individual, as a mom, as a partner. Like it was just really hard to navigate that. And I can say that the opportunity that I had was just, it was just so uplifting and empowering.
Hmm. Thanks for sharing, Alicia. And Alicia actually will be a co-facilitator alongside of Bayo, so it's really cool, and I'm excited for you to step up into that role. Um, Just some key learning. So, as you know, there are a lot of different groups, and everyone had a very different stories to share, different experiences, but there were still themes that came across every single group. And we invite people to share birth stories or their story of origin if they have not yet had a child. And people shared when things were impacted and shaped by trauma or not being heard or seen in the hospital or with their providers. Also experiences of healing, what helped them heal, the importance of culture and infusing culture and ancestors into their birthing journey, not just even in giving birth, but in thinking about leading up to it and postpartum. Um, there's still a lot of curiosity and confusion around birth options. So a lot of confusion around what's a doula, what is their services, what do they offer, what's a midwife, who has access to a midwife, and is there a birth center that I can go to? And so we want to make sure that you all have that clarity, so that you can share that clarity with your participants. And that's why we're also bringing in midwives who can help share some of that information too. Um, there's also a lot of the importance of partners and fathers and extended family in maternal health. And so, not just thinking about the birthing person alone needing to hold all this information and this experience alone, but really thinking about the role and the support that can be offered to partners as well. And how are we really creating these like networks of care for people to exist in? And then another thing was just around the power of connection and storytelling. And, this seems so small to be like, okay, bring together 8 to 15 people and facilitate these. But um, again, for people who've never had the space to talk about their their birthing story, to talk about it with maybe their elders, these intergenerational spaces became really powerful. And so, yeah, we're excited to and feel really grateful and honored that we can help work with you all to create these spaces. And then there's also a lot around how people understand and view maternal health. So around emotional realities and mental health and how people are feeling supported or not supported in those spaces. How because people don't share, there's intergenerational wisdom that can be lost. And so how are we kind of destigmatizing having these conversations so that your grandma can share with you, you can share with your daughter, your son, um, and and then also around like birth options again, figuring out what feels best to you, what are you able to do, and then what people are visioning. So creating a space where people actually dream and envision what could look like and really feel like if they had all the resources that were accessible to them. And people talked about the importance of relationships, community-rooted care, being culturally grounded, and how can we start making those tiny shifts now? And then last, again, around the liberated birth. We wanted to make sure that it wasn't just about creating visions, but thinking about what can happen at the individual level, at the community level, and the institutional systemic level, and what action we can take because there's so much momentum that comes at the end of these conversations. People are kind of fired up of like, okay, what now? I'm more clear my vision, I'm more clear of my needs, I'm more aware of what resources are out there. And so we do activities that allow people to think about what action they can take, but what we're trying to think about in this next year is how people can actually build on that. So, is there policy that people can become involved in? Is there more capacity building we can do for people to kind of become ambassadors to share this information out more widely? And so, yeah, Vital Connections is also trying to think about how can we harness some of this momentum and action so it can have a wider ripple effect. This is another photo from Boston Healthcare for the Homeless. We have our midwife, Melissa Nelson, who is so incredible, who joined many different groups. And as you can see, it was really intergenerational, co-ed. And someone shared, there's so much knowledge about maternal health that needs to be shared with anyone planning to have a child. BIPOC women especially need to be able to advocate knowledgeably for their health and the health of their child. And so, yeah, this was a really fun group. A mom and her child, another young kid, a grandma. So we were always happy to have these intergenerational spaces too. And then this is someone's drawing and kind of vision statement for what their liberated birth, their visioning for their liberated birth. And so you can see if you can look closely, but they have father, mother, grandparents, siblings, cousin, friends, um, hands that hold, pray, console, doctors who listen, know and honor, respect. I can't read that. Um, and then another quote is a liberated birth celebrates and welcomes life, joyous, grounded, and free. And I think we should all, and when we're facilitating this, also taking the time to do these activities yourself. And so you can also be a part of the process and thinking about what a liberated birth experience look like for you. Okay, so now we get into phase three. So there's a lot of similar pieces. We're continuing to scale the conversations, create opportunities for new partnerships, and support past partners. We're continuing the train their model. So we'll have this comprehensive toolkit that we'll provide to you that will help you think about recruitment and implementation, icebreaker activities, maternal health resources, and we'll also have recommended activities that have been based on the past couple of years that partners have done, and they found that they worked really well. And so we try to make it as easy as possible, knowing that you all live very busy lives. But we're also trying to expand the framework a little bit based off of feedback. So we're you can see some of the modules is around exploring birth stories, birth options 101, meet the midwife. A new one is around perinatal mental health, creating a vision for liberated birth. Another one, new one is around self-advocacy and advocating for yourself or your partner and your family, and then taking action. There'll be co-facilitation support by a midwife again. And then this year, a new addition is a perinatal mental health specialist who will come in and talk about PMADS. And so talking about postpartum depression, anxiety, OCD, treatment and support. And so we're really excited to have that addition as that was part of the new bill is trying to add more resources and screenings and support for birthing folks and their partners. And then we'll also be updating a family and pregnancy resource guide. So if you have resources that you want to share, that you want to include, please email me. And we're currently updating it right now. And so we'll want to make sure to put those resources in. So partner responsibilities for you. Um, your responsibilities are to identify facilitators for these conversations. They can be within your organization. You can be bringing community members. As you see, Abeo and Lanisha have decided to co-facilitate together. And so these people need to help co-design and facilitate the conversations and participate in a few trainings we'll offer. You also have to have the ability to recruit 8 to 12 participants. I always recommend over recruiting to 15 because we did have a lot of partners that had difficulty having that retention and having people join from session to session. And so over recruit, knowing that some people may not be able to attend the day of. Um, Another responsibility is to attend trainings organized by Vital Connections. So we'll do a facilitator training, and then we'll also have a 1 hour session by a midwife who is talking about, so you all have a better understanding of the difference between a midwife and a doula, where people can access midwives. And we'll also have a session co-facilitated by a perinatal mental health specialist. So you all feel more prepared going into the sessions. Then you'll be responsible for co-designing this conversation series and scheduling sessions. So as Abeo said, they sent out a survey to participants to see what times work best. And so that may be something that you will do, or maybe you already have programming built into your organization where you can use this time and dedicate it to these conversations. Then you'll be responsible for facilitating an 8 to 10 hour community conversation. disseminating the pregnancy and family resource guide. By disseminate, we just mean share it with the participants, you know, share with other people who may find use for it, and then support and evaluations efforts. And that is through note taking. And if you're chosen, we'll talk more about how you can take notes. And then distributing a really brief post survey to participants so we can learn more about what their experience was like. Any questions around responsibilities around any of these? Yeah. Yeah, Kanisha.
Sorry, I'm trying to find with the mute button. Good afternoon. I just wanted to confirm. So so we'll be as a partner. The partner will be facilitating with their organization and then having the support of um, midwives and other professionals with us. Is what you're saying?
Correct. Yes. So I recommend having two facilitators just so, taking turns between activities, being able to better survey the group, take turns note taking. And so you and someone else will be the main facilitators. But then we'll have one session or one like, 2 hour block where the midwife will join. And then we'll have another hour and a half, 2 hour block where the mental health specialist will join. And so they will not help co-facilitate the whole thing. They'll come more as like drop in for one session to kind of take the lead. You're still holding the container, but they will be responsible for delivering the information. And you'll meet with them ahead of time just to like talk through, here's who I'm bringing together. This is the flow. Because some people wanted to make it more informal with the midwife, and it was really just Q&A. Others were a bit more formal, where they had the midwife give a presentation and then opened it up for questions. And so it's up to you all to decide like what feels best for who you're bringing together. Did I answer? Is that
Yeah.
clear?
Yes. And I also wanted to ask, so what does this look like for a new organization? Because my organization is new, but I also partner with Union Capital. So
Mm,
I'm not sure what that will look like because I'm not like, you know, Golden Street Health Center or any other place that's like very, well known. In my
yep.
community, I'm known, but it's not like I'm a doula as well.
Mm,
So yeah, so
that's great.
so a lot of who I work with or who I know is through be doing work as a doula for over my son's 11 now, so about almost 12 years. Um, and so I just wanted to know like what that looks like for someone who's new. Again, I have support from Union Capital, but I just want to know like for someone who probably doesn't have support in that way, like what that looks like for them.
Yeah, I mean, I would recommend really thinking about um, who are who are people already in your network that you could share this opportunity to. And it can maybe you're doing first like direct outreach to if you've already led workshops, maybe you share this with people you've done workshops with. If you can bring back together the same group of people who you did the workshop for, and have them participate in this, because we are really recommending for people to have not start recruiting randomly. I think that's where people ran into challenges this past couple years, is when they're just trying to like be like, okay, who can participate in this, because that it just people had challenges finding people and having and securing attendance. So first working with entrusted spaces where they already know you, they already know the kind of space you create, they'll have more buy-in. And so thinking through that for as a first strategy. And with Union Capital, you can also share this opportunity out with Union Capital, but maybe first going to Union Capital members that you already work closely with. Is that helpful?
Yes, that's very helpful actually. Everything you said makes sense because I have done workshops. I have been building a community. So I just wanted to know because again, I'm not a big thing yet,
Yeah, yeah, and that's
So
okay. We don't like it doesn't we're not working with just like very established big organizations or healthcare settings. I think what's more important is like knowing that you have a group of people that you can work with and draw from in this conversation series.
Thank you.
Yeah.
There's another question in the chat. This
Yeah.
for dem
Hanaya, okay, thank you. For demographics outside of our communities as a recruitment assistant. So we encourage you all to um, work within your communities or work with um, yeah, the main communities that you normally work with. So um, we don't do too much recruitment assistance because we work with so many partners. We can't support with putting out like calls for okay, work with this group, work with that group, because then there could be some like conflict of um, opportunities. And so um, I would think more about like, okay, based off my work right now, who do we work more closely with? And again, does not have to be birthing folks. La Alianza also brought together some grandparents and they brought together younger folks. And so it can be a mixed group, but thinking about then you will have to consider facilitation and how are you holding space for a multitude of experiences and perspectives and making sure not one or two people are not just like holding the experience of the birthing person sharing. But I don't know, you can if you have a deeper question to that, let me know and I'd be happy to share.
No, thank you. That answers the question. I'm thinking
Okay.
through a company's model and how
Mm,
we get clients, which is not like someone can't, we do recruitment. So we have a lot more things to jump through with like payers and providers to get clients and then client information and figuring out how to utilize the systems we work within to best able to meet the need of the additional people we would add, right? So just
mm,
thinking through some of those things. So, but that was helpful. Thank you.
okay. Um, and Marcia shared do a list of resources we can use to recruit or ideas about creative recruitment strategies. Marcia, can you share more about resources we can use to recruit? Are you talking about like listservs um, or what do you mean by
I'm
resources?
wondering if there's a list of organizations you have that do other kinds of birthing work, do mother groups that you know of, that sort of thing that are in general that are listed that we can just reach out to.
Yeah.
Or
I mean,
hospital groups.
I think for Hyde Park, I mean, you all have the greatest understanding of the groups that exist within Hyde Park. And so I'm happy to brainstorm or like do outreach to other people that we work with within Hyde Park. Um, and I know that you all had some momentum from from your first year of ideas around like, okay, we could work with this group a little bit more. Um, and our hope is in applying is like you're not spending a lot of time of recruiting because you already have an idea of who you want to bring together. So I think that is the challenging piece is like not bringing in 15, 20 random people because that could take a lot of time, especially with like I noticed a shift from, a year ago to a group that was trying to run 3 months ago with there's so much more happening and also not always feel people feeling safe um, joining random groups right now and or leaving their homes. And so thinking more about like, are there people we could tap into from our previous conversation or but I'm happy to think for you for Hyde Park of like groups that are supporting fathers or mothers or young teen groups in Hyde Park that you could work directly with. And just for Vital Connection support, it'll be a $5,000 mini grant, and we encourage partners to use these funds for planning time, facilitator compensation, materials, and participant incentives. We don't need a budget, we don't need receipts. This will be a lump sum that is sent to you, but really thinking about paying participants for their time. And so if they're dedicating, their Saturdays, um, what are you doing to make sure that they are feeling like their time is being valued? Maybe you're providing childcare, meals, things like that to make it a positive experience. We'll also be providing the community conversation toolkit, It can be provided in multiple languages. And so if you right now it's in English and we're translating it's in English and Spanish, but we're also happy to translate in other languages if that'd be helpful. And then ongoing training and technical assistance. I'm always happy to jump on a call, text about it, email about things, based off of like, okay, this group did this activity and it worked really well. So never feel like you're alone in coming up with ideas. And even of course we're saying like recruitment's on you all, but like I'm also happy to brainstorm those ideas too. We'll provide facilitation support. We'll do a birth options 101. They'll be led by a midwife. We'll have a perinatal mental health specialist, lead a mental health 101, and then, of course, the 101 support for conversation planning. In terms of eligibility criteria, having a physical location to host a group of 8 to 12 people. This can be a space you rent. It can be within your office if you have a physical space already. But just thinking about a space where other people are not going to be able to eavesdrop or pass by. Um, so what can be a space that's easily accessible for folks? 5 to 6 hours of staff time for prepping and training with us. The ability to recruit 8 to 12 community members between April. Oh, sorry, I should have updated that. That's old. Between end of beginning of February and the end of June. And then we welcome all identities and languages and communities to apply. But we are interested in working and reaching BIPOC women, men of all ages, Spanish-speaking individuals, immigrant families, teen parents, members of the LGBTQ plus community, and elderly or intergenerational groups. And for lessons learned, I've kind of shared some of these throughout, but I'll just hone in on them again. So we did find that partners that had existing programs and participation thrived and had people attend from session to session, while those requiring a bit more outreach face more challenges. And we have had a few groups that have had to return funding because they weren't able to recruit, they only were able to recruit 1 or 2 people. And so thinking through this beforehand, so that doesn't end up being the case. Also, we didn't we're encouraging people to do host these in person, but we also recognize the political climate, the social climate, and people not feeling as safe gathering in person. And so, if you would need to pivot and do virtual facilitation, we are happy to work with you to make sure activities are just as accessible and engaging. So please note that is an option, although we encourage in person if possible. And then because there was some facilitator confusion around birth providers and birth options, that's why we're hosting the trainings ahead of time so that we don't expect you to be experts in this, but we want you all to feel confident when you're bringing together your participants to share information. So that's why we've made that change. And then I keep talking about this toolkit, and um, this is what is included in it. So it'll have some logistical overview, guidelines for recruitment and implementation. It'll go into detail the curriculum and sample activities, icebreakers and bridgers and closing activities. If you're new to facilitation and don't know how to, what type of activity you can do to get people to first connect or close space, facilitation tips and best practices, maternal health resources, a note-taking template, evaluation tools, and then also a facilitation template you can use to as you're crafting your plan. And I'm open to more ideas. I'm updating this right now. So if there are other things you'd be like, oh, this could be useful, let me know and I'll see what I can do. So next steps, submit your application. I'll drop it in the chat after this. We'll be reviewing the first round January 12th at 5 p.m. So the next day. I won't do it after work hours. And then by January 6th, then we'll do some one-on-one calls so I can ask you some questions about what you're thinking, and who you're bringing together. And then by January 16th, I'll notify the first ones if you're moving forward. And then January 23rd, the first round of sites will be selected. Oh, I'm sorry. Let me say this again. I messed that up. January 12th through January 16th, I'll be reviewing them. And then between January 16th and January 23rd, I'll be having one-on-one calls. And then we'll have the kickoff meeting on Thursday, January 29th from 12 to 1:30. So please hold this time if you apply. And then also know this is um, running applications, so a rolling application. So we'll be accepting applications through early April 2026. And so if you're like, now is not the time, maybe take a beat and you can reapply in April if that feels like a better timeline for you. So I'm going to stop sharing. That was a lot. And see if there are any other questions or if any of past partners, so we have Ella here from Bowdoin Street Health Center, and Ellen and Marcia are here from the Hyde Park Group, and Abeo and Lanisha from Trailblazer. So if you all also want to share any of your experiences, please feel free to do so or questions.
I have a question, which kind of
Yeah.
goes with sharing experience, but I think I recall when we applied the first time sharing a budget outline. So we don't need a budget outline. That's the change this time.
Yeah, I mean we you'll see in the MOU that there's like a example budget. But always recommend making a budget for yourself, but it's not
Right,
like
right.
we will review the budget and say, okay, this is where the money has to go. We're going to follow up with you afterwards. Because we recognize people have different costs depending on if they have the space, if they already have built-in facilitators whose time is paid. So yeah, that's correct.
Okay,
Yeah.
thanks.
And Ella, now since you unmuted, do you want to share really briefly about like your process or the partnership between you and Family Nurturing Center and how that kind of helped create this space?
Yeah, so I didn't have when I applied in like a specific population that met regularly here because the grant really values having people already know each other since there is sort of that baseline of trust, which I appreciated. So I quickly thought of the Family Nurturing Center and their Nurturing Fathers program, since it's gentlemen who have been in a group together, whether in virtual space or in person space, and partnering with their facilitator to co-facilitate with our family partner who focuses on our OB patients, since he already has that trust built. So we recruited 8 gentlemen to be a part of a 2 half-day Saturday program and go over everything. And it was wonderful. They had really good feedback, ideas, of course. Certainly a lot came up around centering fathers and their experience, which was really helpful for our family partner and myself, since she really typically focuses on the expecting patient, the birthing person, rather, in addition to the father, but, really focuses on the resources that they have and brings the partner in as needed. So that was helpful and got us thinking about programs here. But I do think that because they all had the same experience of being a father, going through this Nurturing Fathers program, there was that trust, and it really felt like they opened up pretty quickly. I felt like we had breakfast together so that they can kind of get to know Rosie and I, who they hadn't met, and then kind of the walls came down and we were able to facilitate a really valuable and deep conversation with them.
Thanks, Ella. Yeah, Kanisha.
Yes, I'm not sure. I think I applied. I don't know if it was like an interest thing or not. My mind's like I was at the Union Capitol thing last night, so my brain is like trying to catch up.
All
But
good.
I just wanted to know if you can confirm if I have application in or if I need to send one in.
Um, I believe you do. Um, yes, you do. So you submitted your application. And so you're
Thank
welcome if you
you.
want to make any changes, you're welcome to resubmit. Or if you're fine, then that's good. Any other questions or ideas that you want to share out with the rest of the group? Is Vital Connections plan to integrate youth adults through this initiative, or is that more for health equity summer internship? Can you share more about the question? because we would love to work with youth. We are happy for you to facilitate this conversation series with youth, if that's what you're hoping for.
Yeah, that's what I was asking. I'm a college student. I'm in nursing school, so I was asking like, is this something that I could be involved in or because you
Mm.
mentioned like having to have like people to recruit and kind of having like an establishment or being a part of a company, and I'm not really a part of anything. I'm just a student, so that's why I
Mm.
was asking.
Yeah. Well, thank you for being here. How did you hear about this opportunity?
Well, I applied for the internship last summer and then I didn't end up
Okay.
getting it, but I continue to follow Vital Connections on LinkedIn
Mm.
just because I'm like I have a really strong interest in maternal health. I want
Yeah.
to be like a labor and delivery or postpartum nurse, so I continue to like follow you guys on LinkedIn and check out for any opportunities.
Amazing. Oh, thank you so much. Yeah, I mean, so you don't have to be from a set organization or group. If you have people that other nurses that you want to bring together, that's totally fine. I don't mean you need to have the structure or systems in place. It's more about having people in mind who you want to bring together. But if you also want to offer your service and say, hey, I'd love to co-facilitate with someone. Maybe other people are looking for that support who are facilitating alone. That's also an opportunity. Um, and also there's probably some really incredible people for you to connect with in this space too, who are in the maternal health space. Are you at BC at the nursing and midwifery program, or is that what you're hoping to do?
No, I'm actually an undergraduate
Okay.
student, so I'm not a
Wow.
nurse yet, but
Okay.
I'm a junior, so I'll be graduating in 2027.
Okay, amazing. Well, yeah, please. So I guess on this call, if people are looking for a co-facilitator or looking for someone to help support in any way, Gianna, is that how, am I pronouncing your name correctly?
Yeah, it's Gianna.
Gianna, feel free to put your email in the chat, and people can reach out if they need more support. And then I'll also keep you in mind for other opportunities that came up or just like events that we're hosting, because we'd love to have you stay involved.
Okay, thank you.
Yeah. Any other questions or thoughts? Ellen, Marcia, don't mean to put you on the spot, but putting you on the spot, and if there are any reflections from your past, doing this last year. Actually, was it this year? Who knows time anymore? But if there are any thoughts that you want to share with the group, that'd be great.
Thank you for the offer. I can say that I have nothing but positive to share. I'll let Ellen say some more since I am in a context where I really can't speak. I'm just listening in.
Mm. Okay.
Hi, this is Ellen. I think one thing that I would like to share is we were one of the groups that had some issues with getting enough people together and having people follow through on. We had plenty of people that we thought were going to be part of it, but it was a difficulty with them just not showing up or having things happen at the last minute. So I definitely would say that you want to have at least 15 people. Um, pre-registered so that if that happens, you have a backup. And, we've kind of been thinking about maybe reaching out to Hyde Park Pediatrics or Lowney Medical to see if they have, people that have given birth recently or are interested. Also, we were a multi-generational group, which I highly recommend. It was a wonderful experience. And one of the people was a Haitian grandmother, and her daughter, who had just given birth, and the baby attended the sessions. And it was really excellent. But we're thinking of reaching out to her because she had a very strong Haitian community that she worked with, that she felt that she could get together a group. So again, it's kind of finding that base of people that you can pull from. And in her case, she would serve as an interpreter because that would be needed for some of the Haitian community. So I think I think that's about it. It was a great experience. Um, and for people that are worried about the midwife part or anything like that, um, we did not know the woman who came before the session for the midwife, but she was fabulous. She kind of gave a mini presentation and information, and then she took a pretty good amount of time for follow-up and questions and answers. And it was a really nice part of the session. At that point, we did have a third facilitator, and she was a doula, and or she still is, but she has moved away. And that was another very helpful outlook to have both the doula and the midwife present.
Great. Thank you so much, Ellen. Any from the rest of the group, do you all have any questions for Ellen or Ella or Abeo? Okay, great. Well, we can wrap up 6 minutes early, but I hope this was helpful. I'm around. I'm happy to answer any other questions that you all have, and I will be offline starting the 19th, I believe. So I won't be checking then, but I'm around tomorrow and the rest of next week. So please reach out if you need anything. And yeah, I'm just so excited for this next cohort to start. So thank you all so much for taking the time and look forward to being in touch soon.
Thank you.
Thanks, Mary.
Thank you.
Yeah.
Thank you, Mary.
Thank you.
Thank you.
Bye.
Thanks, Mary.
Anisha, great to see you. See
I
you
see you
soon.
too. Now back to work I go.
Yeah.